OneWorld Health was started just over 10 years ago, and our mission is to provide quality, affordable care to communities in need. And really, the genesis of OneWorld Health dates back to a couple of decades ago when one of the founders, Dr. O'Brien, was in medical school and had spent a lot of time on short-term mission trips serving internationally. And the way that Ed would tell the story is that he would go and do these trips. And the first couple times he did them, he felt really good about himself. He kind of gave himself a pat on the back and look at all the great work that I'm doing. And the more that he would do it, the more trips he would go on, the more questions he would start asking. Well, where are the healthcare providers in the countries that I'm flying into to serve? And what happens to, patient number 284 of that trip that I diagnosed with a chronic condition and only gave enough medication for 30 days? Why are people sleeping on the ground to be seen by me? What's the breakdown in access to quality healthcare that's causing all of this to happen? And so as we started to ask those questions, it drove into a deeper conversation with some other folks around, well, is it possible to create a sustainable impact in healthcare in the developing world? And that's really where OneWorld came in. And so there are a lot of incredible organizations that do what we would consider to be parachute medicine or relief-based clinical care. Very salient, very important for that to happen in a lot of contexts. But we want to go one step further. And so in places and in contexts where folks don't have access to quality healthcare, we want to come in and create infrastructure, create processes and efficiencies and effective models that will allow us to serve a community for generations to come. So opened our first facility in 2011, January 2011, with 7 Ugandan staff, saw 240 patients that first month. As we speak today, we have 12 facilities across the globe. So that would include Uganda, Nicaragua, and Honduras. Well over 200 staff providing care to over 10,000 patients on a monthly basis now.